SLOs are posted. They're,
They probably would have asked if they can record, I'm assuming
oh
that's why
yeah,
you
y'all
had
can
your hand
record, I
up.
don't care. I can save you a little bit of a headache though, and some battery time. Your SLO is listed, testing's gonna come from that SLO. Ms. Garrettson is going to do the second part of Oxy 1, and then I will come back after that and do all of Oxy 2. All we're covering today is ARDS and a little bit of patho. ABGs and stuff, she's gonna go into more in detail, and so is Dr. DeLima with that. So, what I want you to look today is at the SLOs on ARDS. What causes it? What do we need to look for? How are we gonna fix it? Okay? If you go to the next thing on there, we're gonna have to plan a care, right? Go to this first handout. We put all of this up there for you. There's an entire handout that brings it all the way through, anything and everything you wanna know about ARDS. There's also another handout on, methods to deliver O2. There's also a way to figure out how much percentage your patient is in. So I would highly suggest it would behoove you to look at those handouts. Just say it, okay? Don't blow them off. There's also, Ms. Garrettson actually recorded the entire lecture, and the lecture is posted. So, I'm gonna try not to really go over as much detail like she did, because that's gonna take you a little while to let that sink in. We're today, what I'd like to do is do kind of like a kindergarten version, to where you have some idea when you leave this room on how to figure out ARDS. And people get ARDS mixed up with acute respiratory failure. The failure, a lot of that is distress. Okay, let's figure out, if you look at this, who are the most of the people? We're gonna start with aging. The best way to describe that, you can memorize all those things, decrease this, decrease, 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 everything decreases, okay? Just remember that. That's why older people, you gotta watch a little bit closer in the hospital. They have a little bit more difficulty trying to cough, trying to move, trying to breathe. They have decreased sensation. They don't know that they're getting sick. So, look at all these things and remember, the best answer is usually everything is decreased, okay? And their bellies may get a little wider. So, what happens when this goes wrong? Let me see if I can, we're gonna, Ms. Garrettson explains the disassociation curve really well in there, but what I want you to know is you have a capillary. Let's look at it like this. Now, I do not have a degree in art, okay? So, we've got one that goes like this. And then we have another pathway that goes over here. In this pathway, we're gonna put this as the PA and this goes to tissue. Don't have to write this down, just listen, because you can get it much better in the lecture thing. What happens is, all the blood, the used blood that's already been all over your body, is coming down here into the lungs, okay? And as it's coming in here, it usually will fix itself and pick up and put some more oxygen in and fresh oxygen and go to the tissues, the brain, the heart, the liver. While it's coming down here, the molecule loses one or two. So when we get down to here, we have about 75%. Down here lives all these little tiny things that look like grapes. If you think of a fish aquarium, the bottom of the fish aquarium where the grass kind of wiggles up and down and it kind of filtrates the stuff. Same thing here. With ours, for some reason or another, something back here caused a malfunction in here. And these little things just start getting bigger and bigger in a group, and they start looking like little tiny raisins. That causes a leak. When it's starting to go back out here, it doesn't have as much oxygen. It's lost it down here because some of it has literally leaked out. You're gonna see it over here in the consequences of what happened. This has to go somewhere. So the next thing you're gonna see is all of this is gonna be fluid in here. It's usually not cardiac related, okay? So you got all this fluid in here. What do you think if you've got fluid in your lungs? What are you gonna hear? You're gonna hear something that's abnormal. You know? You're gonna, if you've got all that fluid in there, you're gonna be short of breath. You're gonna be uncomfortable. Does this happen all at once? No. Usually you'll start taking like 24 hours. Is usually the first phase of it, where it first starts. When that fluid gets in there, the lungs get stiff. They can't move. Think about it, Thanksgiving. You got all this food in there. Oh my God, I can't move. And you get lazy. So the lungs get stiff. They're wet. They've got all of that in there. And if they're wet, you're gonna hear noise. Now, if you take this person over here, and let's pretend this is a railroad track, and this is the bus station. I mean the train station, sorry. This person over here walks over here, is on this train. it goes straight for a little while, then it goes this way, and then it can go that way. This one is going to be your right shift. This one's gonna be your left shift. That's what we're gonna just call the road, okay? Because people, kids, students lose it with left shift and right shift. Just think of it like an interstate. First trip, first town that you come off on that right shift is gonna be a town called Sepsis. The next town is gonna be called Fever. The next town is gonna be called Acidosis. Next one could be Exercise. And the next one, bicarb, greater than 45. If you didn't get on that train and you got on the left train, this is gonna be more acidic. This one was gonna be alkaline, okay? So, what are you gonna see in these people with a left shift? Decreased temp, such as a drowning. Let me think of what else. Low CO2, less than 35. Just remember, you've got two of these. First, you're gonna see the acidosis, then it should switch back over. It's gonna be real slight. That's why you gotta start thinking, you know, what's going on with my patient? They're on the floor, your patient seems fine, all of a sudden, you start noticing a trend, something's changing. And your mind should start thinking, what is going on with this patient? Example. Let me see where, all right. What I want you to do is, on your blank sheet of paper, just pick out some key facts. Anybody read the sample? Probably not, okay. Mrs. G, she's a 72-year-old female on a med-surg floor. She was hospitalized 3 days ago for pneumonia. She's been on a continuous pulse ox and receiving O2 at 2 liters. And she's on antibiotics. Took a chest x-ray earlier, showed little change in pneumonia. And what do we know about chest x-rays with pneumonia? A lot of times they don't show up till a week or 2 weeks later. She has a history of chronic lung disease. At the beginning of the shift, the nurse hears a low alarm of her pulse ox, a reading 89 to 90. On assessment, she finds the patient alert, oriented, no distress. Heart rate 96, respiratory 24, with diminished breath sounds, blood pressure 124/80, and temp is 38.1, which is 100.6. Because this nurse is unfamiliar with this patient, she asked the respiratory therapist that's getting ready to perform a breathing treatment about her baseline. And the respiratory therapist tells her she kind of like lives down there. She assures her that her pulse ox usually runs low. And she's kind of like at her baseline of 92. Well, this nurse wonders how to interpret the pulse ox. And she remembers, she sat in class somewhere and she heard something about the curve and something about the ABGs. So she starts thinking. Now all of a sudden, Mrs. G's pulse ox is low. It's in the upper 80s. Vital signs are unchanged. The doctor calls to get a urine culture and another IV. Start another IV antibiotic. The nurse clamps the catheter to get the urine. She comes back a little while later and there's only a tiny bit in that catheter. Another red flag. Mrs. G, she's alert, but now she's restless. She puts her up in a chair to eat. She goes off and sees her other patients. She comes back 20 minutes later, and Mrs. G is slumped over and unresponsive. She calls for help. She tries suctioning, still unresponsive. And guess what? Mrs. G has a DNR order. So they don't do anything. The husband had gone home. The nurse calls the husband back. He comes back and he says this to the nurse. I know you gave her good care and probably didn't know she was going to die, but I would have liked to have been here when it happened. Later, the nurse reflects on her experience with Mrs. G, and she realizes she missed clues of quickly developing hypoxia. Although Miss G was a COPD patient and her pulse values were lower than normal, she really didn't go back and look at the ABG values and look at the pulse ox trend. So, what do you pick out of that? She was awake, alert, oriented, vital signs were fine, right? With anytime you have something abnormal, I don't usually listen to what somebody else says, if that's normal for them. I wanna figure out why that's normal for them. If you told me your pulse ox is always 88, I'm gonna say, oh, okay. And she's sitting over here saying, are you kidding me? She's sitting over there with an 88 pulse ox, something's wrong. Same thing there. It should start making me think. Yes, she had COPD. Does she get short of breath when she moves? When she came back, she had started getting restless. Number one sign, right? Never should get restless. You guys are gonna get restless at what, 9:15? So I know anything I say at 9:15, y'all not gonna listen, because you gotta go take that test. You're getting restless. And I'll be able to sense it up here. And that's what I want you to do when you're on the floor, okay? Her pulse ox starts dropping. Another problem, it didn't matter if it just dropped one. It just watch and see. What else? You know, the heart, the lung, the kidneys, they all play in the same neighborhood. And when you were a kid, I'm sure all of y'all played some type of sports, especially baseball, where you needed a pitcher, a catcher, a first base, and someone outfield. And you only had 4 people. And one person says, if I can't be pitcher, I'm not playing. Your team falls apart and you're ticked off. Every part